Lininger. Today we're going to talk, this is episode 2 in our continuing series on spinal arthritis and spinal decay. It's also known as degeneration. Yesterday we talked about normal, we talked a little bit about the different types of arthritis, osteo and rheumatoid. We also talked about what normal x-rays look like, what you should have in your spine, what it should look like, and normal anatomy. So today we're going to talk about the first stage of degeneration, or what we call phase 1. This is where someone has left the bounds of what we call normal, and they've started to degenerate and develop the first signs of arthritic or arthritis on the spine and on their X-rays. So the phase 1. They're gonna start to see, if you look here on the model, they're gonna start to see this scalloping, that's called, of the vertebrae, where we just have some striations in the bone, and we don't have a perfect square anymore. What we have is something that looks like it's been squeezed, and it has been squeezed by the force of gravity pushing down on it. That's what causes this. Fixation plus gravity plus time equals arthritis in the spine. Okay, so again, the brain's up here sending information down the spinal cord through these nerves. The discs have begun to thin out, so you can see that this one almost looks like it's dough being squeezed between the two bones here. So you can see that it's coming out over the lip of the bone. Also, the hole around the nerve, because the disc is disappearing or thinning, it's beginning to disappear or getting tighter around the nerve. Now, we also note the biggest hallmark of a stage 1 problem is that we go from, in the neck or the lower back, we go from a curve in normal to no curve in stage 1. So we've lost that curvature, which starts to put abnormal pressures on the discs and nerves here. The first stage is marked by that loss of curve. The bones are still have a well-defined margin, but they are starting to scallop. We do have a little difference in the disc height, but not very noticeable on the x-ray. So the main hallmark is the loss of curvature from the lateral view. At this stage of degeneration, they may not even have symptoms yet. But if they do, they're usually going to come up like, the most common one is fatigue followed by headaches. Okay, so they're getting a little tired. They're not going to have tremendous symptoms here. Not usually, anyway. There's always the exception, but in most cases, they may have some increased tension. They might get headaches. And because the force of gravity is continuous, what will happen is this will degenerate further in a few more months. Okay, so we're going to go into stage 2 if it's not corrected here. So that's stage 1. That's what you can see, what you can experience during stage 1. What's typical is muscle pains, headaches, fatigue. You're not going to have pain going down the arms and legs, although I've seen it in stage 1. But it's more common as you go into stage 2 and 3. So that's all we're going to talk about today. On the next video, we're going to discuss phase 2. Okay, so that's phase 1. And I'm Dr. Lininger, and have a nice day, and we'll see you on the next video.